Packaging, dispensing, filling, labeling, checking, delivering, preparing and administering, all by hand for each tiny pill, takes an enormous amount of time, effort, and money. These inefficient steps in the traditional drug distribution process make providing cost-effective, quality care difficult for long-term care providers. But at KVM Technologies, we've made it simple by combining all of the time-consuming, labor-intensive tasks into one easy process. Introducing the Envoy Automated Medication System. Designed specifically for long-term care, Envoy is the only system that automates the entire drug distribution process, from the time inventory is loaded to the time of administration.
How you doing?
The system packages, fills, verifies, labels, sorts, tracks, replenishes, and dispenses from bulk inventory right inside the nursing home. This 24-hour automated pharmacy brings dispensing closer to the patient, while pharmacists operate remotely to enter and authorize orders.
Oftentimes you get that call for that emergency medication, and the beauty about the Envoy is the pharmacist can be at his or her home and have access to the Envoy through a modem in their home computer and enter that medication, and the nurse can then in fact obtain the first dose or doses for those patients.
With automatic packaging and dispensing, the entire distribution process is easier and quicker than traditional methods. Pharmacists are freed from drug handling and delivering, while nurses immediately receive pre-sorted medication in resident-specific envelopes ready to administer.
With the Envoy, the whole process changes. The pharmacy is no longer filling the order back to the pharmacy. This greatly enhances the nursing time as far as administering medication. They have fewer packages to open, fewer packages to handle. It ends up saving the nurses a lot of time.
Envoy eliminates bingo cards and unit dose packaging by securely storing a bulk supply of 176 different oral solid drugs in unique container cartridge combinations. Together, the combination provides an immediate and reserve inventory of medication. Each container has an embedded memory chip that stores drug information corresponding to the barcode on the attached refill cartridge. Once the container's inventory is completely used, Envoy releases the reserve supply from the piggyback cartridge. This automatic refill process prevents drug outages and lot number mixing. The computerized link with Envoy and the container and cartridge also prevents errors, simplifies loading, and increases the efficiency of inventory control.
With the Envoy, there are limited returns because they're only drawing the medications from the Envoy on demand, maybe 3 to 4 hours before the administration time, and not dispensing large quantities or 30-day supply. If the medication changes, the Envoy software can be updated, and you would only deliver the new medications or the medications required for that administration time. Within the Envoy, it decreases the number of returns probably by 70 or 80%, if not greater. And it helps decrease the personnel time within the pharmacy of processing those returns.
Whether you're accessing the immediate or reserve inventory, medication is always ready for packaging. To completely eliminate cross-contamination, each container has a flexible silicone probe. Envoy applies a vacuum to the probe to extract any size or shape of oral solid drug. The system then packages single or multiple doses into MedView envelopes labeled with drug and resident information. Envoy folds, crimps, and sorts each envelope as desired by the nurse into one of 7 convenient med-tote carriers. The system also prepares PRNs, first doses, and small numbers of doses and delivers them to a separate bin on demand by a nurse.
You can get PRNs or first doses in a matter of seconds, probably about 30 seconds from the time you punch it in until you take it out of the PRN bin.
With Envoy, medication is ready when you are. The system simplifies routine med passes by freeing nurses from selecting and preparing medications.
The Envoy will cut a med pass in half. The minute you're ready to start your med pass, you go. You don't spend time with a lot of preparations. You don't have to go through the drawers. You don't have to open blister packs. And everything is in order according to your med pass. You just verify what you have with your MAR and compare the two, open up an envelope, and you're on your way.
Whether you're inside the nursing home or at the pharmacy miles away, you'll find that Envoy's modernized approach to drug distribution offers many other benefits, like 100% transaction reports, automatic leave of absence drug packaging, and controlled non-oral solid medication storage. Using Envoy's unparalleled technology, you'll gain time, reduce drug costs, and improve the quality of care.
The Envoy system has helped us to manage a subacute unit with fewer personnel and fewer costs in our pharmacy. It's helped the facilities to receive better service by having immediate access to medications and decreased returns that their nurses have to handle.
Before Envoy, your patient care consisted of medications. After Envoy, a nurse has time to individually spend time with the patient and take care of their needs. Is terrific. The Envoy, I would like to see the Envoy in every nursing home that I ever go to, ever. It's awesome.